Okay, so the idea now is to talk about the cranial nerves, their position relative to each other, and generally some about each. So the first cranial nerve is the smell, the olfactory nerve, which is the first cranial nerve, mainly sensory, what is mainly only sensory component. The second cranial nerve, which is, let's call it inferiorly to it with respect to anatomy, is the optic nerve for vision. Again, it's a sensory only cranial nerve. It's the second cranial nerve. Now, the third cranial nerve is the oculomotor nerve, and the oculomotor nerve is mainly or only motor. It controls some of the eye movements, not including, for example, the lateral movement of the eye, the abduction of the eye, because this the abducens does, and we have the trochlea that also does some movements, but oculomotor does most of the eye movements, and it is purely motor cranial nerve. It is the third cranial nerve, and again, it is positioned inferiorly to the optic, the second cranial nerve. Now, the fourth cranial nerve, the trochlear nerve. The trochlear nerve is again a motor cranial nerve only. It again controls part of the muscle of the eyes, and it contributes to the movement of the eye. And again, it positioned laterally and inferiorly to the oculomotor nerve. The next cranial nerve is a mixed cranial nerve. This is the trigeminal nerve. It has branches, the ophthalmic branch most superiorly, the maxillary branch in between, and the mandibular branch. It is also called V1, V2, V3 respectively, and it has mixed sensory and motor components. Sensory, it goes to the area of the eye, the area of the maxilla, and the area of the mandible. It is sensory innervation to these areas. And in motor component, it, for example, related to a motor of the masseter muscle, for example, the muscle of mastifications. So it has both motor and sensory components to the trigeminal nerve, and it's positioned laterally and inferiorly to the trochlear nerve. As you see, we're going from superior to inferior. This is how the cranial nerves goes. So the trigeminal nerve is the fifth cranial nerve. The sixth cranial nerve is the abducens nerve. It controls the abduction of the eye. A very interesting something to know about the abducens nerve is that it goes in the cavernous sinus, and this is the one that goes more medially. This is why it is more can be more easily harmed, for example, from tumors in the, for example, pituitary or things like this. The next cranial nerve, the abducens was the sixth cranial nerve. The seventh cranial nerve is the facial nerve. It's a mixed cranial nerve. It has also a motor and sensory components. Facial, as it sounds, it's related to the facial muscles, and it contributes to these muscles, to its motor components, and the sensory innervation of these muscles. And the next cranial nerve is the glossopharyngeal nerve. The glossopharyngeal nerve again is more laterally and inferiorly to the facial nerve, which is laterally to the abducens nerve. The next cranial nerve is one of the longest cranial nerves and one of the most important cranial nerves, the vagus nerve. Now, when we're talking about the vagus nerve, it's again mixed sensory and motor components, and it is a very long cranial nerve. It has many functions. For example, in the heart, it is the one that is responsible for the parasympathetic innervation in the, for example, the sinus node, and it causes a reduction in heart rate. It also part of the parasympathetic system in the intestine and the bowel. So it has a lot of components. It's very long, it's very dominant, the vagus nerve, and it's one of the important part of the parasympathetic system. Now, the vagus nerve is below, inferiorly to the glossopharyngeal, which is inferiorly to the facial nerve, which is laterally to the abducens nerve. Now the accessory nerve, the accessory cranial nerve, which is the 11th cranial nerve, it's important for movements like this one. And when we're talking about the components, it has only motor component. And the last one is the hypoglossal nerve, hypoglossal cranial nerve. It's important for movement of the tongue. It has only motor component. It has no sensory component. So the hypoglossal nerve is more anteriorly compared to the accessory nerve, and it is in the area of the medulla oblongata approximately. So those are the cranial nerve: olfactory, smell, optic, vision, oculomotor, movements of the eye, trochlear, movements of the eye, also trigeminal, mixed motor and sensory of the face, mastification and branches, V1, V2, V3, ophthalmic, maxillary and mandibular, abducens, movement, abduction of the eye, facial motors. There is Bell's palsy that can cause a paralysis of the facial nerve, and it presents as known as Bell's palsy. Sensory also of the external auditory canal on the external part of the ear. The 7 is the vestibulocochlear that I didn't talk about. It's important for vestibulo, the vestibular system, which is important for wait, I need to finish. Vestibulocochlear is important for vestibular system, so it's important for standing and positioning and balance. This is the word that I would look for. And cochlear for hearing. So the vestibulocochlear nerve has two components, the vestibular part and the cochlear part. The vestibular nerve is also in superior and inferior segments, but never mind. And the 9th cranial nerve is the glossopharyngeal, and then the 10th is the vagus, which is important for parasympathetic system. The 11th is the cranial nerve, and the hypoglossal is the 12th cranial nerve, which is important for the tongue movement. That's it.